Hello and welcome to Facebook Live. This is Dr. Brie coming in from my boutique little Parker satellite office. So nice here. I just wanted to check in with you guys. I felt like I kind of owed it to myself and to our clients to explain my change in thoughts around testosterone therapy. In January of 2023, I actually did a Facebook Live that was Friends Don't Let Friends Get Pellets. And here we are today in February of 2026, 3 years later, with a different perspective. And, we're all allowed to change our opinion and change our mind on things, but I wanted to kind of explain how that occurred for me and why we're excited to offer Avexapel pellets at our osteopathic clinic in Denver. We don't have them at the Parker location just yet, but maybe one day. Basically, in 2006, I met an amazing mentor, and I was a third year in medical school. And as you know, the Women's Health Initiative in med school had told me that hormones are bad. So I was told estrogen is bad, nobody should take it, and testosterone is going to give men a heart attack. This is the training I came out of. And then I met this holistic OBGYN who was using hormones with comfort and counseling and ease. And she felt really comfortable with hormone therapy. And I'm so grateful for that pivotal moment in my career, because had I not worked with Dr. Fry, I don't think I would have ever been as comfortable as I became as soon in my career. So I've been prescribing hormones basically since I graduated from residency after doing mentoring and learning and educational updates. I've been following the trends and the tides all these years. But one thing I remember distinctly about working with Dr. Fry was that she was also a sexual health expert. And I thought, one day in my life, I'm going to be at a place in my career where I'm going to add this in. So when I went to the Menopause Society conference, my favorite speaker was the sexual health speaker. I find it really interesting to learn about sexual health along the side of treating so many perimenopausal and menopausal women and men who are in midlife in my career as a family physician and holistic family doctor, because, there's a lot of intersection between hormones and how you feel in your body, mind, spirit, sexuality, and connectedness, and they're all kind of related. So testosterone in the very beginning, when I was prescribing it to women, I would put my toe in the water like 2 milligrams. How do you feel on 2 milligrams? And I was like, oh, nobody feels anything on 2 milligrams. So then I would give women 4 milligrams, and then 5 milligrams, and then 6 milligrams, and I kept just trying more and more to get people to a place where they would feel it, and feel better. And, over the years, there has been not a lot of progress in our options for women, especially. So, to this date, there are over 30 products that have been approved by the FDA for treating low testosterone in men since 1950, and there are 0 products for women. I have a great ear on the pipeline of future therapeutic options, and there is a great company called Hava that's trying to bring Australian technology to the United States for FDA approval, hopefully one day, on testosterone pellets that are special, that actually reduce the breast density on MRI, improving the ability of MRI to detect breast cancer and mammograms to detect breast cancer, especially in high-risk patients. There's some really good potential future there. So when I started to hear about testosterone pellets in women might actually one day be FDA approved and also might be helpful to reverse dense breasts, because we get this report on pretty much, the majority of mammograms and MRIs over the last several years have been really concerned about this density problem. So when I started actually, seeing my patient population age along with my cohort, started to talk to friends and started to prescribe to people who, had similar experiences to me in perimenopause. And I listen to my patients. I really do. I pride myself on that. Our team prides ourselves on that. And when my patients tell me things, I'm like, are you saying that these pellets are actually making you feel more like alive again? They're helping you feel like yourself. They're helping you to have, reduction in brain fog. and a release of fatigue you felt like since you started noticing changing hormones? I haven't seen that on any dosage of the creams or the gels that I've been trying, especially in women. I'm uniquely positioned as a family physician to also be able to prescribe hormone therapy for men. And I've prescribed testosterone for men for many years as well. And again, the thing about testosterone and how people feel is really complicated because we want to follow labs. Like, I love labs, I think they're so fascinating. And I just want to follow a lab and I want the lab to match how you feel. But hormones don't always work like that, especially because our body is so good at maintaining homeostasis, a balance, right? So what happens when you give somebody testosterone? Well, the body just makes more sex hormone binding globulin and gobbles it up and binds it, so your body doesn't always feel the increase. So we have to, use different methods, different dosages, different frequencies to be able to help the body to kind of supersede that and actually help people feel the levels that we're trying to get them to feel. But is there a level? Like, is there really the right level? And that's still a question. In fact, there was a study and a survey that I was looking at that basically said if you look at, different labs, there was a study that's had 17 different reference ranges for testosterone. Some of them, the same result would be categorized by normal by one lab and low by another and high by another. How's that possible? Because the reference ranges that we use to normalize lab values are based on population norms and population, like, if you see a bunch of testosterone levels, you're like, oh, I guess the low is here and the high is here, right? So we make a reference range. And then we think that's normal or abnormal. I think a lot of research will come out about that in my career, and I'm so looking forward to it. I have lots of theories. I think your brain really feels fluctuation, like up and downs, more than it actually feels at a point in time. I think that will come out in the future, and I think our bodies are really good at binding things, and receptors are not always what we expect them to be, right? So I think one day maybe we'll have the perfect monitoring system, but we don't. So instead, we have to go on how people feel. And in prescribing creams and gels and topicals and injections over the years, I find that many times I would get a lab value that wouldn't match how the person would feel. So especially in women, I would say, oh, okay, it looks like we've improved your levels. And they'd be like, yeah, I can't really tell. And after a few months of messy creams and putting things all over, people are just like, I'm not sure it's worth it. That's not how you should feel. You should really be able to distinctly tell if you are, taking a hormone and getting it to a therapeutic level. You should feel relief of symptoms, right? So in perimenopause, for women, what do we expect testosterone to help with? Okay. In my early career, I thought it was a home run on libido, right? But especially the creams and gels, probably not. Libido is complicated. Drive is complicated. Men and women get complicated in midlife. There's a lot we could talk about there. But the truth of the matter is, if you work with creams and topicals and gels, it might be really hard to get your testosterone level to a place where your libido really gets jump started. And certainly harder even as a woman to go from the place of responsive desire where it's like, okay, finally, if all the dishes are washed and I'm in the mood, I'm ready to go, then maybe, right? But to really spontaneously think about it again and to spontaneously desire it, that typically is going to come from super therapeutic, higher than the normal reference range on the lab values of testosterone for women. We really have to drive those numbers up a little bit to start to see that sexual responsive, sexual desire, and spontaneity sort of return. So if that's something you're looking for, that is possible, but really only with pellets, not with the other topical creams and gels, because it's just really, really hard to get people, and especially women, their levels high enough for that. Now, that doesn't mean that you need a testosterone level of a young man or an old man. You don't need testosterone levels of, 200 to 400, but you need them at a place where you can feel it, right? So if that's one of your goals and that's what you're looking for, then that's a place that is an absolute benefit that you can get from pellets that you can't always get from the other methods. In fact, It would be great if there had been an approval of the 2004 patch that the FDA had in front of itself to approve for women, that it actually made an increase in happy, spontaneous sex drive and satisfaction in women, but they failed to approve that. So here we are yet again looking for options that we have to kind of learn about on our own and find providers that are comfortable with. The other, things that we can expect to benefit are body composition. That's probably the number one reason why we added pellets to our clinic, is because we have been so impressed with the GLP-1 medications and lowering your fat percentage and helping with inflammation, help people to achieve weight loss goals with microdosing, and really just making that whole cardiometabolic process so much easier for people, and managing the potential for chronic disease. It's been really wonderful, to be honest. But what we see is that the muscle mass struggles. When you lose weight, you can lose muscle mass too. So we wanted a tool that would help us to prevent that. And in combination, the GLP-1 medications and testosterone pellets, it's potential for a home run. In fact, it's that biohacking longevity hack that people are using right now. So we figured we would get in charge of the tool there at our clinic, because we also like gentle dosing and we like to replicate your normal physiology as much as possible, right? So we are not gonna, send your testosterone levels through the roof just so that you can, quote unquote, feel better, and then just, turn a blind eye to the rest of your, health factors or kind of your personal preferences, right? We're always going to take those things into consideration. So we did choose Avexapel in particular because it is a pellet, this like rice-sized pellet, and it goes in the booty for women, and then in the love handles for men. And it has a mixture of triamcinolone and testosterone, and that kind of creates a slower rise, because that was the biggest side effect I was typically concerned about with other manufacturers, is this big spike, right? But what we see with Avexapel, the levels do rise. We see it as a slower, more sustained release. And I do think actually that it's a more physiologic state to get to that slower release, steady state. You can actually get people with regular pellet insertions at a more steady state than really probably any of the other methods, which are like morning and then evening down, or twice a week you get an injection, or twice a day you can do Kysotrex and try an oral capsule, but that's not even available for women. So of all the other methods, this probably replicates, as close as we can to this kind of longer sustained release, as long as, we help people to find where their level is that they feel the best, right? And that brings me to the real home run that I have seen that really convinced me when my patients started saying, my brain fog is gone. My fatigue is gone. I feel like myself again. It's really hard to get there in perimenopause and midlife, as you know, and for men too. It's like some days you have to take a nap, some days you have to, go lifting, sometimes you gotta, drink a bunch of caffeine, whatever it is, to kind of keep up. Midlife is bookended for many people by changes in hormones, and increase in cortisol, and weight around the middle, and having to work harder at the gym to build muscle. It's harder to sleep. You are bookended with your kids and sick parents, and there's many stressors in this midlife for people. And so we have to look to the tools that help people to feel better. And anything that is going to say, my burnout is gone, my brain feels like it's working again, that's when I really started to listen, because as you know, my brain health program is near and dear to my heart, and it's hard to treat brain fog. It can come from lots of different places, and many people are discovering in midlife that they actually have ADD or ADHD type symptoms that are just being unmasked by these hormone changes, and it treats that. It really helps if you can get your testosterone level to a place where you can stay more focused and stay more energetic. That little resilience that comes from having something left over at the end of the day is actually huge for people. And I see that with the pellet therapy, and I did not see that before with the other options that we were using. So Of course, we have to talk about side effects. There are side effects to every medication, and I'm not making recommendations for you. You should talk to your personal doctor. If you're interested in Avexapel in particular, you can go to their website, find a provider near you. It doesn't have to be us. I do think they're a superior company in terms of how they make the pellet, as I mentioned, but also how they place it. We have a blunt tip trocar so that when it's going in, it's less likely to create a scar tissue pathway, which as an osteopath is really important to me. So, if you are interested, you can get your levels checked, you can find a provider, you can talk to somebody. You can think to yourself, am I working with somebody that's looking at my whole health? And all of those things are important to have a real two-way conversation and to say, can I go with the lowest effective dose? Is okay. You don't have to go to the highest dose all the time. You can go to the lowest effective dose for you and you can see how you feel in a few months and go up the next time or down the next time. We have agency, we have choice, we have communication. That's why you want to work with a provider that really honors your own experience. And symptoms at the end of the day are the best driver. It really is about how you feel. We want you to feel your best. We know that people age, we know that life happens, we know that brains change, bodies change, and we want to help you feel your best. Side effects are possible in any sort of hormone therapy. Mostly with pellets, we look at acne as a potential side effect, so that may cause you to want a lower dose if you have a history of adult acne in particular. Although some hormonal acne is driven by, estrogen and liver congestion and other things. But that's something to consider. Hair loss, there's a lot of information, a lot of myths about hair loss and testosterone. The truth of the matter is that hair changes in perimenopause and hair changes as for men as they age as well. Most of that is about dry hydroxytestosterone. It's a metabolite kind of downstream from testosterone. And that is something that some people are genetically prone towards. Just because you change your testosterone levels doesn't mean you're going to be one of those people who converts to dry hydroxytestosterone, has the hair loss here. Hair loss on the scalp and hair thinning, that's just part of the process of perimenopause, unfortunately. We see that in stages of life with any hormone transitions and with stress. So that one is, you can't really pin that one to any one particular hormone as much as kind of the global aging process. And there are things, of course, to do about it, different day. I don't really notice a ton. There's not cardiovascular risk like I was taught. You actually see lower cholesterol, lower triglycerides, higher HDL. People are more motivated. They tend to exercise more. Those are all beneficial things on your cardiometabolic risk. We don't see some of the other, high blood pressure risks. A lot of the benefit of pellets is that it goes into your subcutaneous fat. Whether you're a man or a woman, that bypasses the liver. And that's actually a really good thing because the liver has a tendency to conjugate or change the chemicals of our hormones. And sometimes that's not to our advantage. So this is a bioidentical option. It is now available with our Healing Pathways program for our healthy hormones for men and women. If you're interested in talking more about it, you can reach out in our patient portal or you can reach out for a meet and greet. And I hope that no matter where you are, you recognize that there's so many tools in your toolbox and you've got to find a provider that listens to you. You got to tune into what you need and you got to find the right tool in the toolbox to help you to feel your best at every stage, right? And this is our newest one. So hope you have a great day.